Today we'll be discussing exercise for geriatric populations. Um, to start off with, there are more geriatric and elderly people in the world today than there were in any other years or generations. There are over 16 times more people between the age of 75 and 84 than in 1900. And there are over 38 times more people in 85 or above 85 than there were in the 1900s. So the rising population of geriatrics, there obviously has to be a more focused uh, outlook and also a better understanding of what geriatrics can and cannot do. Um, Start off with common misconceptions. So to start off with this, many people don't think that elderly are capable of participating in exercise because it leads to tiredness and loss of energy through the day. Um, Many people don't believe that they're capable. They're also it's very time consuming and they cannot find the time of day, or it takes too much time. They have other things to worry about instead of working out. Um, and also that it can lead to injury, which, yes, all exercise can lead to injury, but if properly managed and properly done, then injury can be maintained or even lessened. So, old people. I said earlier a couple statistics that there are more old people than there ever have been. To start off with the idea of old people or middle age populations, middle age is between 40 to 60-year old, and you begin to lose about 10 to 20% of their biological function during that time period. Old age is 65 to 75-year old, continued loss of function. Older age is 75 to 85-year olds. Potential impairment, motor functions, and other detriments to their body, and also diseases such as cardiovascular disease, diabetes, similar things like that. And then the oldest population, which is 85 years and over, which generally is your institutional care, which people who live in nursing homes or in other care facilities like that. To start with this, adaptations to aerobic and anaerobic training for geriatrics. These are just a few. Increased heart size, larger stroke volume, lower resting heart rate. Those are just some of the many different adaptations and positive benefits of exercise, cardiovascular exercise in geriatrics. Um, Other things are increase in blood flow, a more manageable blood pressure, and also increased blood plasma and volume. And by increased blood plasma and volume, I'm talking about the hematocrit levels and plasma levels. You can see approximately a 3 to 5% difference in red blood cell count, which is not necessarily a huge amount, but it does it can be shown in people who definitely participate in exercise. To go on to resistance training for geriatrics, increased strength, power, muscular endurance. Another thing that people have found is that there's an increase in balance, and this is particular and this is important because if you have an increase in balance in older people, they fall less and they're less likely to have a hip injury or need a hip replacement or break a bone, because a lot of old people, they do develop things as brittle bones and osteoporosis. Another is decreased loss in motor function and finite motor functions. Um, Additional motor units recruitment is another main thing that will help geriatrics. And then muscle hypertrophy. Not all geriatrics are worried about muscle hypertrophy, but some, even if it's hyperplasia, hypertrophy can help elderly get through the day, or even it helps with increased strength and all those. The risks of resistance and cardiovascular training. Obviously, there are all kinds of risks when it comes to exercise. You can lead to injury in the weight room because not everyone knows how to lift or when to, or the proper ways of doing certain things. So there's obviously an increase in injuries or possible injuries, tiredness and fatigues during day's workout um, due to a decrease in function and bodily function. Geriatrics are not always able to recover and repair their muscles as fast as younger populations. So they could be tired, they could be fatigued, they could feel overworked, they get dizzy, lightheadedness, even into arthritic pain or muscle flare-ups or muscular pain, and even in severe cases, a stroke or a heart attack. Dosage of exercise. This is just it's a baseline. 1, 2, or 3 days per week. I like to stick with 2 to 3 days per week because I think it gives the most variability and also it keeps a structure to exercise. Easy to mild exercise. There's no reason to push an elderly person to the limits at all. They don't need to be doing that. I would suggest some free weights, some form of free weights and exercise machines. So examples of exercise, an elliptical for 5 to 10 minutes or a seated bike for 10 to 15 minutes. Also, you can do machines, exercise machines, so a push press, a bicep curl, a tricep dip, similar things to those to increase strength, endurance, and it gives variability throughout the exercise.